Hello everyone, welcome to this Labostix broadcast. This is Labostix broadcast, part of the broadcast edition. A Labostix broadcast, a part of a Labostix release, um, a uh, a broadcast edition, part of a chartered edition and evidence-based perspective. This is a Labostix broadcast, part of the Communicade, and a broadcast edition, a part of another Storm Robotics production. As part of this Robotics broadcast, what I thought I'd do, or as part of this Robotics broadcast, the overview will be in around looking at sort of retrospective collaborative works, where this collaborative works was between two academic institutions in the United Kingdom, one in the one academic institution in the southwest region in the United Kingdom, and the other in Wales, in the United Kingdom, and where the works where the collaborative works was linked, was collaborative with within the tech industry as well. And so in this collaborative works, we looked at collaborators looked at looked at data for medicines optimization, and aligned to sort of best practices. And this works was presented at a data at a data driven medicine symposium, or seminar, in 2019, in at the academic institution in Wales, in Wales in Wales in 2019. So this works in around in around in around in around so aspects of this works. And there was a basis where collaborators looked at data insights into medicine's use in sort of nursing and care home, in nursing home and care homes, in around different sort of different in different parts of the United Kingdom, where particular where particular uh, electronic medicines administration records were being utilized or implemented. And so in around this works, the source of data for analysis included a sort of a handheld device or handheld tech for administration of medicines in care and nursing homes, and where there was where the handheld sort of technology, handheld tech, had um, a sort of a barcode a barcode verification aspect to individual um, to allow professionals within care homes, care and nursing home industries, within different care homes and nursing homes within the industry, to have specific barcoding access to sort of to allow sort of the appropriate administration in around in around different medicines in nursing and care home facilities. And there was an integrated aspect of this tech, with pharmacy practice or pharmacy records. There was information at prescription and dispensing information and at prescription dispensing administration levels, and the tech also had what had been referred to as a scorecard for real-time data analytics in around medicines management. And in around this at the same time, there was there had been some evidence sort of works in around preliminary works looking at looking at sort of the looking at the tech in context in context of in context of electronic medicines administration and aligned to administration medicine administration records, and where preliminary evidence in around this works highlighted, for example, or preliminary works that evidence specific aspects around this works before had highlighted, for example, 21 out of 23 administration errors had been eliminated by the tech, by the handheld device or the tech. There was an average of 65 hours staff time per month saving, sort of utilizing or implementing the handheld tech or device, and 9 hours per month and 9 hours per month that have been sort of evidenced in context of in around the scorecard, in around the handheld scorecard analytics, and in around this this as well. Safety. There was some data. There had been some data in line to the safety of delegation of medicines and administrations from nurses and carers using the handheld tech as well. In around this works, collaborators had highlighted in the works that had been presented originally at the data-driven systems sort of medicine symposium 2019, that the collaboration as where a an Innovate UK knowledge transfer partnership, or KTP, a sort of grant had been won by the collaborators and the aims of this works in context of big data for better health, for better care homes, or better care in around nursing and care homes, was where the collaborators aim to use or highlight outline electronic medicines administration record data to highlight the sort of the optimization of medicine use in nursing and care homes. And so the ideas of this works also included, for example, to highlight sort of real-time data analytics on medicines used at individual home and care and group and at group levels. Also, the ideas was to include a sort of a dashboard overview in around the data analytics, reports for further details in around specific aspects of in around the handheld tech, but also in around sort of analytics, in around the analytics at specific sort of levels at specific levels, and sort of where the data around this works, or collaborators also seek to highlight sort of risk scores using or utilizing or implementing aspects of machine learning algorithms in the original collaborative works. And in the original collaborative works, there have been some illustrations or schematics, for example, that provide an overview in around the sort of dashboard and reporting examples in context of practices in nursing and care home facilities. Uh, and um, and in this works, for example, um, uh, there was one of the illustrations or schematics in this works highlighted an example of how a dashboard could look like at individual level. So areas could where different aspects of the handheld tech could be color coded to demonstrate whether for example they are relevant to patients or service users in nursing and care home facilities, and where each area would then have an associated report providing sort of details. So in the examples, for example, there was a dashboard aligned to, for example, Parkinson's medicines, falls and risk score, anticholinergic risk score, antipsychotic and sedative sort of score, in around or sort of score in around GI bleed risk, current antibiotics, nutritional supplements, pain in the last 24 hours, and sort of aspects of, for example, missed medications or missed meds, and also aspects in around where different medicines, specific medicines and different medicines, had a different sort of directions, different directions in around aspects of the dashboard. Uh, so as well as this works, as part of this works, the collaboration also looked to have the collaboration prompted sort of propagated a sort of a case example in around polypharmacy and its influence on nephrotoxicity in context of renal impairment. And so what this works looked at, as well as part of this was where the aim of the works was to outline the sort of association or relationship between medicines with a particular focus excuse me, a particular focus on polypharmacy and renal function by examining the use of nephrotoxic medicines and medicines that require dose adjustment in around renal impairment in sort of those in a sort of those nursing and care home sort of from nursing and care home sort of bases. So the objectives around the objectives as part of this was to perform or conduct a sort of a retrospective point prevalence descriptive analysis of the tech, around the tech and the data to demonstrate that sort of dispensing patterns for nephrotoxic and renal dose adjustment medications in care and nursing home populations, and to also identify original ways to monitor individuals who are at risk for renal impairment, sort of using in context of using sort of the tech in and around primary care, and to also consider the potential advantages the potential advantages of identifying individuals using medicines sort of management sort of tech. So in around the sort of intro as part of this works as part of this sort of works was where healthcare and technology have been or have are and have been sort of advancing sort of rapidly, as in the experience as is the experience that health and health and care professionals and those that they sort of look after, who have become sort of accustomed to using technology or aspects of tech in day to day, and expanding on data collection in around sort of renal insufficiency, as well as external data linkages, particularly to care home medicines management, would um, in, to care home medicines management would also allow more detailed understanding of which individuals are more at risk of renal insufficiency, and this would help in around this works this would help pave the sort of the way for more transparency in around data in around medicines management and screening programs, potential sort of a potential to the potential to sort of screening programs for individuals in context of those in care homes and nursing homes, and so in around this as well, the collaboration the collaboration sort of propagated sort of definitions and bases around polypharmacy as well. So polypharmacy definitions are and overprescribing had been highlighted in literature and works from, for example, in works in 2017, 2019, and sort of more sort of historically or retrospectively. Early intervention and the importance of risk assessment and prevention is critical in sort of the care home or nursing home populations. National Institute for Health and Care Excellence, or NICE guidelines have been aimed at primary care in context of primary care, and the recommendations are aimed to address known unacceptable variations in sort of assessment and initial treatment and referral for example, in line to renal replacement therapies or RRT. The inpatient mortality of renal insufficiency varies considerably depending on its severity, the setting in context of intensive care or not, and many other patient related factors. But in the United Kingdom, might typically be 25 to 30% or more. In view of the frequency and mortality rate, prevention or amelioration of just 20% of cases of renal impairment or renal insufficiency would prevent many deaths and substantially reduce complications in around aspects of associated to the disease to the the disease. Now, in around the sort of methodology around this works, the data used for analysis was provided by the tech companies sort of handheld tech system or tech sort of device, and the medicines were coded using a dictionary of medicines and devices, and the medicines included sort of nephrotoxic medicines and medicines that require dose adjustment in renal disease, and where databases were chosen based on investigations that based on investigations and studies that had identified aspects of polypharmacy from the in the literature from 2007 and 2012, and drugs were grouped utilizing the British National Formulary and categories, and for the nephrotoxic medicines were further grouped against four particular categories. So, for example, diuretics, angiotensin converting enzyme inhibitors, and then non-steroidal anti-inflammatory drugs or NSAIDs, and also a particular antibiotic, for example, referred to or known as gentamicin. Um, and in and around the sort of analyses, in and around the analysis of this works, in around the analysis, point prevalence descriptive analysis was conducted using specific software, and these there were a total of 81,299 items currently in use. 2,946 of these were included in the list of nephrotoxic medicines, and 9,896 were included in either the nephrotoxic or renal dose adjustment medicines list. There were a total of 7,976 individuals. There were a total of 7,906 individuals. Of these, 2,374, so just under 30%, were prescribed at least one nephrotoxic medicine, and 5,278, so just over 66%, were prescribed either a nephrotoxic medicine and a renal dose adjustment medicine, or both. Now, in around the sort of results around this was 504, so just over 6% of individuals were prescribed 2 or more nephrotoxic medicines at 60 at age 65. So just over 0.5, just over 0.5%, just over 0.5% were prescribed 3 or more, for both nephrotoxic and renal dose adjustment medicines. 2,728 were prescribed 2 or more, so just over 34%, and 1,198 were prescribed 3 or more, so around 15%. The most commonly prescribed nephrotoxic types included diuretics, followed by angiotensin converting enzyme inhibitors, or ACEs, and relatively few individuals were prescribed an oral non-steroidal anti-inflammatory drug, or NSAID, and only one was prescribed parenteral gentamicin. In the collaborative works, there are schematics that summarize the data, and that summarize the data. However, in regard to this, so individuals living in residing in care and nursing homes, especially older individuals, require special care and consideration from prescribers, and this is reflected in the medicines for older people, a sort of a component document of the National Service Framework for Older People have been published retrospectively in 2001, which describes how to maximize the sort of advantages of medicines and how to avoid excessive, inappropriate, or inadequate medicines used by individuals in uh, in uh, 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 sort of care home and in care homes and nursing homes. And with regard to the works, with regard to the collaborative works, the most um, uh, the uh, the investigators also had documented the most important effect is so in regard to the age aspects in this collaborative works. The collaborators highlighted that the most important effect is the most important effect is reduced is where it can be reduced renal clearance. Older individuals excrete drugs slowly and are highly susceptible can be highly susceptible to nephrotoxic drugs. Uh, an individual stabilized on a drug with a narrow therapeutic window, so for example, digoxin, can rapidly develop adverse effects in the aftermath of other comorbidities or for example a respiratory tract infection. The hepatic metabolism of particular drugs are also reduced in this population because there is a reduction in there can be a reduction in liver volume. Again, this is particularly important for drugs or medicines in drugs or medicines with a narrow therapeutic window. So in around the sort of implications or applications in context to practice, polypharmacy is commonly sort of experienced by individuals in sort of in care homes and nursing homes and is often as a result of multi morbidities. It is not always inappropriate. However, becomes problematic if the drawbacks and risks experienced by individuals outweigh the potential advantages. In around sort of tech, in around tech, sort of digital sort of tech or technology and data in around where tech and sort of and around data science techniques can be utilized to improve identification of individuals who may be at risk from medicines from and around medicines and thus um, and thus sort of reduce delays in review, monitoring, and referral to particular services as accordingly. With regard to renal function or renal insufficiency, the use of nephrotoxic medicines may be appropriate in some individuals, and similarly individuals with renal impairment may benefit where there may be some advantage or there may be some benefit from medicines that require dose adjustment. In these cases, there should be consideration as to whether individual or individuals would benefit from sort of from more refined renal screening methodologies. So, for example, cystatin C versus creatinine as a biomarker, or where cystatin C and creatinine in context of laboratory practice or medicine, being where these biomarkers are utilized in synchronicity to improve the accuracy for individuals where using creatinine alone, for example, as a biomarker may be problematic. So, for example, those with lower with for example so for example those with lower muscle mass, since creatinine as a biomarker is dependent in context of in context of renal function or renal function being determined, or where creatinine relies on where creatinine, sorry, is based on a biomarker that is dependent on muscle break a part of muscle breakdown as well. So in around sort of the conclusions of this works, the uptake of technology across health and care facilities, across health and care facilities, in context of data collection, can be sort of advantageous. Data science and techniques can be implemented to draw on insights from tech. Individuals prescribed sort of nephrotoxic medicines and drugs requiring dose adjustment in context of renal disease and care in nursing homes can be sort of easily identified using tech similar to what similar to the tech that collaborators had highlighted in this works sort of retrospectively. And individuals may benefit again from refined laboratory renal investigations or screening in context of the utilization of cystatin C as a biomarker, cystatin C as a biomarker instead of creatinine, or again where cystatin C and creatinine are utilized in synchronicity. And so that draws this draws a close on this Labostix broadcast, part of this broadcast edition. This has been another sort of a Labostix broadcast, part of a chartered edition, an evidence-based perspective, a broadcast edition, part of the Communicade, and another Storm Labostix production. And there will be, as part of this, again, there will be some citations in sort of the in on sort of social media, where listeners can check out sort of the citations in around similar works as well. So once again, it's been a Labostix broadcast, part of another Storm Labostix production, and it's been part of the broadcast edition. Thank you for tuning in.